Hello, good evening. This is Dr. Kulmeet Kundlas, and we had a lot of questions being asked to us after we recently posted a video on healthcare effects and the Thanksgiving, skipping our medication. Remember, you will have high blood pressure, you will have high sugar, you are at a high risk for develop cardiac arrhythmia, you are at high risk to develop heart failure and gastrointestinal reflux and infections. If you skip your medication, it's very bad. If you're going to be traveling, make sure you pack your medications in your carry-on rather than in your luggage with this thing, because it's notoriously during holidays, everything gets delayed. And if God forbid you don't have your medications, you will be in trouble. So take your medication, make it a point to take the medications. And if you have already established heart failure, make sure you take extra water pill and watch your blood pressure. Post Thanksgiving, most important thing is to give your body a break next day and don't go and start feasting again, especially high salt. I think the biggest killing is the gravy. Everything has a lot of salt, but the gravy, if you have blood pressure, heart disease, try to skip that part. And not that in the United States, we have abundance of food. There is no reason that we need to overeat. Let's extend it for 3-4 days, but don't do in one day. This is very important that you take care of that part. Then today, when the patients were coming in, one of the common questions which I was asked over and over, how do I know that I need to go to the emergency room or I should take care of myself at home? I would say, if you start having persistent chest pain, feels like a pressure, or you are short of breath, you cannot lie flat, or you start having palpitation, you start feeling weak, dizzy, fainty, those are the signs. Fortunately, our emergency room physicians, nurses, they are highly trained and they are prepared that you will be showing up, and they have already developed a capacity that there will be increased 10 to 15% number of visits which normally happen. They will be happening and they will take care of you out there. But those are the things which we don't mention. Key thing here is make sure you don't fast, high protein and fiber, limit your alcohol, go with the plate method, go for seconds after 20 minutes, and enjoy each other's company. Do not go crazy on eating and drinking too much. It is noted that on holidays, and especially around Thanksgiving, on an average in the United States, we gain from half a pound to 2 pounds every year. And this half a pound doesn't look much, but 30, 40, 50 Thanksgiving, this is a cumulative effect. We eat on an average from 3,100 to 4,000 calories in one meal. That's a food for 2 days. That leads to your blood pressure going up by 10 to 15 points, 10 to 15% increase in hospitalization and emergency room visits. And remember, Christmas Day is the highest day medically to have a heart attack, but this is the second. So just by the process where we are, medically it's very challenging. I wish that we all enjoy this good time and not make it a medical disaster. If you just keep these simple tips, which I've went over a couple of times, I'll repeat it again. Make sure don't fast, limit your alcohol, and take care of all the precautions which we have discussed. I think you will do fine, and you must not ignore your symptoms. Thank you very much.